Leo, the Department of Veterans Affairs is asking for $2 trillion for infrastructure in the coming years. Tell me about that plan.
Yeah, look, these are recommendations that came from the Secretary of Veterans Affairs as part of the Asset and Infrastructure Review Commission. This is sort of like BRAC for VA, base closing round, except in this case, they're talking about what the department's footprint will be across America for the next 30 years. And what they've proposed are really radical changes, things that will affect almost every state in the country. They're talking about closing down 17 major VA medical centers in 12 states, talking about building 14 more in other locations, talking about completely rebuilding 18 others on top of that. And that's before you get into some of these community clinics and smaller venues. Hundreds of facilities could be changed here. And as you said, the total price tag on all this would be about $2 trillion, just a mind-boggling amount. But VA officials are saying that's compared to about $1.8 trillion in what it would be just to maintain the current facilities. So this is actually about $90 billion in spending spread out over 30 years. But still, these are numbers that when Congress starts to look into this plan, they're going to see that. They're going to see some, pretty expensive plans here. And they're going to see closing facilities, moving facilities. That's going to be hard for a lot of them to swallow.
Let's focus on that gigantic $2 trillion number. And for reference, according to the Federal Reserve, all the outstanding student debt in the United States is $1.73 trillion. That's a huge, huge number. That's even more than all the student debt combined. How realistic is it for the VA to get that money?
Well, look, this is parsed out a couple of different ways here. The VA is saying just their regular spending, just what they go into over the next 30 years. Again, this isn't 1 year, but it's over 3 decades. They're saying it would be about $1.8 trillion just to keep maintaining the VA hospitals. VA medical centers are a big business. It is the largest health system in America right now. So we're talking over 1,500 different locations. They need to get staff. They need to get upgrades. They need to get new equipment. So all of this costs money. And what VA is saying is rather than just dump that money in, let's invest a little bit more and get upgraded facilities. Let's move facilities to areas where more veterans will be able to access care. More veterans will have access to things like specialty care and mental health care. But you're right. Those numbers are just so big to talk about. There's going to be quite a few lawmakers who say, we can't even have this conversation. We can't be talking about tens of billions or trillions of dollars when we're not sure if there's waste and inefficiencies within the department.
And your reporting showed that they want different infrastructure to serve the veteran community of the future. I mean, walking into a clinic, walking into a hospital, what's that different infrastructure going to look like?
Yeah, so some of the areas that'll have major medical centers closed down, we'll have them replaced with smaller community centers, maybe spread in different areas of town. So you won't have as many options there. You might not have full, operating rooms or full suite of services, but you will have quicker access. Maybe instead of having one big building in the middle of town, you'll have 5 buildings spread around town. Maybe there'll be one big building 2 towns over, and you'll have to drive to that. VA is saying if all of these changes are implemented, about 200,000 veterans will be within 200,000 more veterans will be within a half an hour of primary care, and about 300,000 will be within an hour of specialty care. So that's a pretty dramatic improvement. The question is whether or not that's worth the amount of money it'll cost.
Have you heard from the veterans community? Are veterans groups saying anything, for it or against it?
Well, look, these are just recommendations right now. So the veterans community is parsing through it and really looking closely at what comes next. There's going to be an independent commission that goes into these details over the next year, makes their own recommendations based off of them. And then both the White House and Congress will have a chance to vote this up or down about this time next year. So there's still a lot of work to be done. A lot of those veterans groups right now are holding back on their criticism and waiting for those public hearings to come from the independent commission so they can really start to dig into what's going to work, what's not going to work. But especially for communities that are losing facilities and losing major hospitals, they're already gearing up for a fight. I've heard from a lot of folks who are in places like Buffalo, South Dakota is slated to lose 2 VA medical centers. Those folks are starting to mobilize already to put up a fight against losing their facilities and trying to make a case for why they should stay.
And we'll see how the recommendations change as they go up the chain. Leo, thank you so much. We always appreciate having you on.
I appreciate it, and I'll be tracking it all year.
You can find that coverage on militarytimes.com.